Hello everybody, this is Dr. Bob DiMaria with another episode of Ask Dr. Bob. Some very interesting questions. The first one was from a friend who has a 9-year-old child who has a case of horrible Tourette's. And Tourette's is when the body goes through a tremor, goes through shakes. It could be at any time, no specific pattern. And they wanted to know, they've been on a clean diet, having major anxiety issues, no sugar, a few bad carbs, and they wanted to know any supplements. Well, I wrote Dr. Bob's Guide to Stop ADHD in 18 days many years ago, and the physiology is basically the same. Your brain needs good oil. Your body processes the food that you consume to make this oil. You may be deficient in a few cofactors like magnesium or zinc or B6. That's one of the reasons that we do blood chemistry, so we can look at the different results and determine what nutrients an individual might need. So if that DHA in the brain is sabotaged, the nervous system is not going to function optimally. I would encourage maybe an essential fatty acid blood spot test to evaluate the exact amount of oil the child has. Now you have to understand something. In this book, I have a chapter on the nervous system. See, a normal neck has a C shape to it. We have found, when I did the pilot study back in the early 2000s, these individuals' spines were going in the opposite direction. So your brain sends messages down the spinal cord to all the organs and tissues. So if you don't get a response from anybody, you may want to come and visit us over here in Cleveland, Ohio, so we can do a proper assessment. The child could have had an alignment issue from a traumatic birth. We see improvement in a variety of conditions just by improving diet and nervous system function. That was a real good question. Okay, Dr. Bob was listening to you about belly fat and bent knee sit-ups, and he wanted to know what CLA is and how it works. So I put a note actually from one of the corporations that we get our information from, and CLA, which is exactly said, is conjugated linoleic acid, helps the body minimize girdle fat. And with a show of hands from people around the world right now, we could have a major windstorm, especially if you're 40 years old or older. It seems like that is the annoying area to try to get rid of. It just helps normal physiology in the body. We also have many people that have fatty livers today. There was just an article recently in the Wall Street Journal about the middle-age problem with the fatty liver. The fatty liver cannot process fat efficiently. I would eliminate as much sugar as you can. A lot of times that belly fat is because your adrenal gland is exhausted. Dr. Bob, what can I do to cure gum disease? Now that's a very interesting question, because you could have, I've seen people with inflamed gums. Their whole body's inflamed. So I personally use a product called Agricept L, which is a citric seed extract. I take 10 drops every day in 4 to 6 ounces of water, and I swish it around in my mouth. So that helps kill unwanted, unfriendly bacteria. Now, if you're a big sugar eater, you're going to have inflammation in your body. On the other hand, I've had individuals who've had gum disease, which is really their bones in their jaw are starting to get smaller. So there's a couple of products that we use. One is called Biost. The other one is OsteoB2. So you might want to contact us. But if you don't have enough digestive enzymes in your stomach, you're not going to absorb calcium. Once again, stay away from sugar. Dr. Bob, I am 64 and I still suffer with hot flashes. Well, what I have learned from my experience, the hot flashes are basically caused by 3 or 4 different reasons. Number 1, it could be lack of iodine. Number 2, it could be adrenal fatigue. Number 3, you might not have enough oil in your body. And number 4, it's low blood sugar. So I have many patients that come into our office that are wearing a fitness tracker. Fitness tracker keeps an eye on how many steps you're doing, etc. Well, I was asking individuals who are having hot flashes what time their sleep was interrupted, and oftentimes about 3 o'clock in the morning, and that's when your blood sugar drops. So if you're consistently between 2 and 3 o'clock in the morning, it could be a blood sugar issue. If you're having a hot flash during the day, it could be lack of oil, could be adrenal fatigue, could be sugar. You know, we have conversation with individuals, and you heard me talk about this, from around the world. So if you're not responding to your traditional care, maybe your natural health care provider is not helping you drill down to the cause of your problem, why don't you come over and visit us? You know, we have people that do come and spend anywhere from 3 days to a week. I promise you it will be the best decision you ever made. I'm Dr. Bob DiMaria.